KTVU Fox 2 News serving the San Francisco Bay Area. Today we are talking about mindfulness in the time of COVID. I'm so happy to welcome to this conversation Jenee Johnson. You're with the San Francisco Department of Public Health. Thanks for being with us.
My pleasure.
Of course, of course. Now you offer the kind of help that many people might not immediately think of when it comes to a Department of Public Health. What is your specialty?
My specialty in the department is mindfulness, trauma, and racial healing. Mindfulness is what we are nesting our trauma work inside of. Basically, we're saying what we need to do in order to be our best for the communities that we serve is we need to understand how we can be traumatizing, and we need to understand how we can best learn how to be present and aware so that we're learning to listen deeply, navigate conflict with more savvy, so that we have greater empathy and compassion. So we're building these inner strengths, an inner band of resilience and calm so that we can meet the challenges that we face. So my work is to help people develop those skills.
I know in the work you do there in San Francisco, you have focused on racial trauma. You focused on people who've been involved in violent episodes. For today's talk, I'd like to focus on how COVID-19 is affecting your work and perhaps more importantly, how it's affecting all of us as we talk about our, yes, physical, but also emotional health. Can you start a little bit with what COVID-19, the pandemic itself, can do to a person who they themselves are not infected with COVID-19?
Absolutely, because it's in the collective and we hear so much about people being sick, people losing jobs, because our day-to-day lives are changed. We're wearing masks, we're going to stores and standing on lines. Some of our stores and places that we frequent are closed. Our whole life has changed, and that sets us up for fight, flight, freeze. It's stressful. And that level of stress where we look out and we see no end to it causes cortisol, adrenaline to rise up in the body. And if we are not really attending to ourselves in more gentle ways, we are on a chronic stress ride for now many, many months.
And so what does cortisol and adrenaline do to a body physically?
Well, it gears us up. It tells us that there's something that we need to respond to. Tiger's coming into the room. Okay, I'm going to need to run. So the lunch that I just ate, we're going to stop digesting this food because that's not what's necessary. I need that energy to go to my legs so that I can run. But if there's no tiger in the room, and we still have that level of energy running through our system, it can be very depleting. And over a long period of time, it can also harm our systems. So there's times when we need that run for the bus in the morning, run up the stairs to catch BART. But then when you get on the train or you get on the bus and you sit down, now you can calm down. If we never have that cycle of calm, that cycle of coming down, and we stay in these upper registers of stress, of high levels of cortisol and adrenaline in our systems, our bodies are more inflamed. We're more open to having our immune systems be more vulnerable to colds and all kinds of symptoms of diseases or illnesses, and it's just not good for us. Bottom line, it's just not good for us.
You talked about that depleting effect. Is that why we all feel so exhausted all the time, even though we're not running marathons every day?
Absolutely. Our emotions, when our emotions are on, if you have like a plus negative side, when our emotions are in the downward side, when we're despairing, when we're discontented, when we're discouraged, even when you say the word, you just feel yourself going, Arr. When we are just living in a sense of depletion. So what we need to actually do is renew. We need to replenish. We need to start building up emotions like appreciation and gratitude and compassion and love. And what the science tells us is that you actually need up to 3 positive emotions to counteract 1 negative one.
And it can be hard to come by positive emotions to begin with, let alone a 3-to-1 ratio.
It can be hard. And this is why we need to be attentive, and we need to be intentional. I like the word intention, because when you set an intention, what happens is then life starts to wrap itself around what you say in your heart and mind you want to have happen.
So this can mean I'm doing my weekly trip to the grocery store. I'm going to say hi to everyone I see around me.
That's brilliant. That's brilliant, because kindness actually is one of the habits of happiness. There are habits of happiness that we can cultivate that actually can make us feel better. And kindness activates the same pleasure centers in the brain, get this, as food and sex. So you say hi to everyone on the line as you're walking online. You open the door for someone. You let someone go ahead of you. Anywhere you can find places to be kind, places to count your gratitudes, counting your blessings, big and small. Oh, the hot water's running. Oh, I love the hot water in my tea. My teacup feels so comforting. Just the simple things. The cool air that brushes on your face in the morning. Counting your blessings, being kind, moving your body with regularity. These are all habits of happiness that you can cultivate.
When you're doing your work with people in the San Francisco Bay Area, what are you hearing now in this time of COVID that you weren't hearing 1 year ago?
Oh my goodness, people are really sad that they can't see their family members. That's one of the things that I hear most often. I myself, my mother is 88 and she's in New York. So have gone many, many months without seeing my mom. I did teach her FaceTime though. So we're finding these other ways to connect, but social connection is also one of the ways that we replenish. And so in the time of COVID-19, when we have shelter in place and social distancing, that level of connection, we have to find new ways to connect. Developing your own family pod or a pod with friends. I connect with a friend once a week on the phone. We do FaceTime and talk. You have to be creative and make up things. I have a brother, a businessman in New York. He lives alone, and he said, "Oh my goodness, I'm not going into the office, and I'm really feeling it." And so he's been, upping his supplements and trying to do, get out and walk, because especially if you live alone, and your work life and your community life is how you get social engagement. It's important for us to be creative in that arena.
Can you help sort of debunk a personal mystery that I hope, or I assume that I'm not alone in feeling? There will be days when everything was fine. I did my work okay from home. I've got a fridge full of food, a little, roof over our heads. Thankfully, my family is healthy and we're all together, but yet I feel miserable.
Yes. It's so common. The ups and downs of, we are energy beings, and we can feel each other, and we can feel the energy of the entire collective. So it might not be happening to me personally, but I can feel the tension, the stress, the trauma, the unrest that's going on with other people. So we have to give ourselves, these are the times when we give ourselves a little extra grace. We say, yes, I am alive and I'm feeling what's happening in my community and around me. So this is the time when I give myself a pass. I give myself something a little extra. Not too many almond croissants like I've been doing, but
you and me both. It's in, I can tell, you're working from home. I've been working from home for the past, 7-8 months. There are people who do not have the ability or the luxury to work from home. And I'm talking about grocery store workers, the mail delivery comes every day. Certainly doctors and nurses, everyone in the medical system. How do you tell those people who are very directly connected to the pandemic, how can they help take care of themselves?
Well, the number one thing is it's the breath. It's what we all have, and it's our breath. It's coming to the breath. It's called stop. So you stop, you take a breath, you observe, and then you proceed mindfully. You give yourself a moment. You can do that in between patients, clients, mail carrier, in between houses, going up someone's stairs. It activates the calming response in the body. And I also learned something else from this beautiful practice called heart math, where you're breathing through your heart center, because the heart has its own brain, and the heart actually sends more messages to the brain than the brain to the heart. And you breathe gently, slowly through the heart center. And then you cultivate a feeling like appreciation or love for someone. And you just sit that. It's called coherence. You're bringing your heart, your mind, and your emotions in sync. And so it's heart coherence, and it's a wonderful practice. Nurses in hospitals, they just taught this actually at Kaiser. We're all washing our hands a million times. Washing your hands, you just take that moment, breathe slowly, nice rhythm through your heart, and cultivate a feeling of appreciation, a regenerative feeling, and then you move on. We are in an age where we have to parent ourselves in a loving way. And so those are the simple things that I really encourage people to do. Come back to what is most accessible to you, the breath. And I also encourage people to make a list of your supporters. Who's on your team? And be sure that you connect with those people on your team. I did a workshop for an organization here in the city, and we asked folks, who's on your team? And a couple of people actually said, I realized that I don't have anybody on my team. And so that was also a good aha moment, even to ask the question. And so then the next act would be, okay, who then can I reach out to and ask, will you be on my team? Will you be on my team could simply mean, can I call you once a week? I did this with a colleague the other day. We ate our lunch together on Zoom. So she's in her house eating, I'm eating. What do you got? What do you have? And so once again, there's the creativity piece, but you must make the effort, the little bit of effort. And let me not also miss mental health support can be very important. When you find I've done all the tricks in the book, let me look to get some professional mental health support.
It's interesting you talk about building your team. My two little boys are doing distance learning. They're in 5th and 6th grade. And a couple of months ago, the school had us fill out the emergency contact form, right? In the event of a major earthquake and we can't get to them, who do you want them to be sent home with? And so our older son is now in 6th grade. He's in middle school, a different school. And so we had to think, okay, of the people he's in school with now, what family would we choose to take him home in the event of a major earthquake? And it was such a deliberate thought process that my husband and I went through, right? To care for our little one. But it struck me, I have never gone through that thought process for myself. Yes. I mean, certainly, thankfully, I have my husband, I have my 2 little children, my parents, my siblings, but really outside of that, I don't really have an emergency contact that I'm not married to or related to.
Yes. I think that the pandemic is also asking us to look beyond ourselves. Know your neighbor. It's a simple, social distancing. Hi, I'm so-and-so, apartment 5G or house, 555. And this, even simple things like waving to each other. Sometimes I actually sit in front of my house and my husband and I are noticing all these people on their walks. And we're like, who are these people? Where do they come from? Because we're all home. And just waving and saying hello. They don't have to be grand gestures, but simple things that will help replenish us and move us out of that mode of depletion into replenishing. Because it's when we live at the higher emotional range that we feel better. And feeling is very important. It's not just what you're doing, but it's how you're feeling.
Now, some people, as I'm sure you know, will not listen to their feelings, but they will listen to the physical effects they're having. So if you can run down some of the physical effects of this kind of stress and trauma brought on by the COVID-19 pandemic, what have you found and what have you learned can be physically directly related to the stress we're feeling?
Well, sleeplessness, headache, extra tension in the neck and shoulders, backache, general feeling of malaise or body ache. All these things can indicate something's not quite right, because the body is keeping the score, and the body is talking to us all the time. And so that might mean that you do need to have a bedtime ritual, bedtime practice, get to sleep early, we've heard it a million times, but turn off the TV and eliminate the blue light. A warm bath, a warm shower, reading a book, soft music. Set yourself up for success. Set yourself up for success for your sleep, and set yourself up for success in the morning. The extra time to just prepare, laying stuff out. Have the oatmeal out and ready, so all you have to do is, turn on the water or pour the water, cut up the fruit so it's there, so that you know that that's what you're going to take. My son works in culinary, and he's working with a chef, and so I'm hearing this noise in the morning, and he's making a NutriBullet to take with him. I'm like, good job.
Yeah, put that all together the night before, I'll keep it in the fridge or freezer, and then just the next day.
And take it with you. So little things to prepare yourself for success. That gives, it's a time for us to turn to ourselves in kind and gentle ways. This is not a time to be hard on yourself, to try to make grand leaps and goals. The grand leap is to get through the pandemic in good health. That's the grand goal. So to take care of ourselves, to quiet down that inner critic, and to be kind, not only to others, but to ourselves.
Can you describe a little bit, that feeling of malaise, that you feel like you've got weight strapped to every limb, and even though nothing is wrong in your life, you still feel, like you're trudging through every minute. Can you also talk a little bit about what we talked about in the beginning of that, the fight or flight, I was just at the store and some other lady took the last 3 packs of toilet paper, right? Why does she need 3 when I didn't even get 1? I've had, sweatiness, increased heartbeat, and I think, wait a minute, what's going on? Can you talk about that end of the scale physically?
Well, what you're describing is that stress and trauma response when our sympathetic nervous system is activated. And so once again, it's in the breath that helps us activate the parasympathetic. So it's like the accelerator and the brakes. So then we get accelerated. And what we want to do is activate the brakes. So part of it is preparing for the challenge. Now, I know I'm going to the store. I know I'm going to Trader Joe's. I know there might be a line. So how do I prepare myself to go out? Do I go out on a shoestring, or do I just wait a moment and take care of myself at home before I step out the door? Or when so that in the midst of the situation, I'm not facing it on empty. This is what those good breathing practices that I talked about earlier, breathing through the heart and activating a very positive regenerative feeling, that's really important. Because when you go out like that, it's like charging your battery. So that when that person cuts in front of you, when they grab the last of whatever, you can just take a breath and go, okay, there will be more. Let me put this in perspective. And that is sometimes what life is asking us to do. I'll take the step back and put it in perspective.
When you mentioned kind of, steel yourself for just going to the grocery store, I have learned that I cannot go on an empty stomach. I need to have a list, because the last thing I want is to get home and be like, oh, shoot, we needed parsley and I didn't get it.
Right.
I'm not going back there for another week. So, just knowing that it's not going to be 20 minutes in and out. And it's interesting because I never thought of doing that kind of prep work before a trip to the grocery store.
Yes.
But that's what it's come to.
Yes. Preparation. We can be either in resistance or acceptance. So a lot of time we're in resistance. I don't like this. I don't like that. Why is this? Nah. And so that generates an energy that is spiraling. And actually, although it's spiraling, it's depleting, because it's not replenishing us with the things that we need to build resilience and inner calm. Being able to hold on to yourself even while the world is spinning. So I'm going to show you my little Buddha is in here.
Yeah.
Snow globe, but this is how the world is. It's spinning around. But if we just hold still for a moment, what's around us settles. And even if some of the particles settle on my little figurine, you're able to see clearly through. And that's what we want to be able to do. Just in every moment to moment, see clearly through. So that often means that stop, take a breath, observe, and then proceed. She took the last, take the breath, proceed.
I like it, because of course no one's controlling those little golden flakes swimming around around the little figurine. You said something a minute ago that I wanted to learn more about from you, and that is the connection between stress and that fight or flight, and how it can actually leave people more vulnerable to physical illness.
Yes.
I think I heard you mention, sort of cold and respiratory. Tell me about that connection between how stress we're feeling can affect us in a very physical way.
Yes, well, it's very well known that stress and trauma, this is why we are working on it in the Department of Public Health, because it's a public health issue, stress and trauma. I mean, we see heart disease, lung disease, mental illness, depression, even cancer. Long-term aggravated stress and trauma over a period of time can so debilitate the body that it leads us into having it physically impacts us, and that stress brings down our ability to fight the things that are coming at us. So essentially our immune system is compromised. And so this is why addressing stress and trauma is so important. One of the many reasons, but for our own physical health, we want to keep our immune system up. So aside from good eating and good nutrition, besides movement is medicine, we want to learn how to calm down. We want to recognize we don't have to make up that things aren't difficult. We can acknowledge the difficulty, but then we want to resource ourselves with the good food and nutrition, with the rest, with the levels of preparation that we've been speaking of. This is how you then are able to move through it. And then we relate better when we feel more resourced, well-resourced.
I know it's far too early for studies, but I'm assuming they will eventually be done. Do you expect the COVID-19 pandemic long-term health effect, even on people who weren't physically ill with COVID-19?
Unfortunately, yes. I mean, we're actually hearing that. We're hearing that from researchers already, that, people who entered the pandemic already compromised or entered the pandemic fragile and are now going through something that is putting an additional levels of stress on their systems and on their circumstances. My therapist, and they are so busy, they cannot meet the need of all the people who are coming to them. So these are the clients that he had before the pandemic, and now new people who are once again recognizing that I need some additional help. So so yes, I think that it's not going to be a one and done, oh, it's over, we have a vaccine, that there is a lingering effect that we will still have to attend to because our systems have been traumatized.
I mean, I joke to my husband that I'm never again going to use a whole paper towel for anything because I've turned into the lady that, just tears one corner off. My mom, she's never chewed a full stick of gum in her life. And now I am so proud to be her daughter. I think about all the things that are going to stay with us even after the pandemic is over. And, I'm sure you're going to tell me that it can take a very long time to undo the damage that's being done, let's just say in 1 year.
Well, here's the thing. Once again, we can look at it as damage done or what did I learn? And that, I think, is really important. It's how we tell the story. And beliefs become biology. This is the words of Dr. Christiane Northrup. What we begin to believe then becomes can lodge itself in our system. So what is the story I will tell about my experience in the pandemic? What will I choose to remember? And we can actually begin to weave a story of, I actually got closer to my children. I actually learned something about my children that I did not know. I actually cherished my relationship with my mother more. Some of those little annoying habits just don't make a difference. They don't mean anything. Right. I actually grew and matured. I actually, we call it post-traumatic growth. It's such a thing. You can improve relationships. You can see new possibilities. You can increase your personal strength. You can increase your spirituality and have spiritual growth, and you can just have a greater appreciation for life. So we can come out on the upside, post-traumatic growth.
So essentially you're telling, sort of more than ever before, we're really left to rely on ourselves to either give ourselves that kind of positive self-talk or to assemble a little team of people that you can call or text when things don't go right. But it sort of really is, it seems, up to each individual.
Well, I think it's a combination. It's the individual in community. I have a friend who changed the name of sheltering in place or lockdown. I hated that term. To sheltering in peace. What if we decided to shelter in peace and went on a path of discovering what would that take to do that? So that when I am at the end, I can say I grew from this in some positive way. Suffering is universal. It happens to all of us, individually and collectively. But people often tell the story that I'm not glad it happened, but wow, what did I get out of that? And I think that we have an opportunity to reset our mindset around this story, how we got closer to colleagues, even though my colleagues, I haven't been in their physical presence since March. We meet every week on Zoom. We've laughed together. We've cried together. We've still have been together, thankfully for technology. So it's how will we tell the story? Will we go doom and gloom, or we say, in spite of this, and every great move of suffering in humanity, there have been people who will tell you, yes, that happened, but I'm still here. And that's the victory.
Wonderful. I love talking to you. I wish I could just talk to you, for an hour every day, but we'll have to end the conversation soon. Before we go, I'd like to ask you, I'll ask you in a minute for online resources for viewers to check out on their own. But before we get to that, what do you hope we learn from this pandemic?
I hope, my favorite word, one of my favorite, kindness. I hope we learned kindness. I hope we learn to have more compassion. I hope compassion means that you have a sense of someone else's suffering and you take a look to see, is there anything I can do about it? There may not be, but you at least look. And I hope we learn. I hope we learn that. I hope we are just not are willing to try to be more understanding.
I like it. I love it. And finally, for those online resources for people who want to learn more about what you're telling us now.
Well, one of my favorite resources is the Greater Good Science Center. It's at UC Berkeley, and they have a host of things that help us to take a look at how we can look at our fatigue, engage more positively with our children, manage stress better. So I would say that that is one of my top resources, the Greater Good Science Center at UC Berkeley. And Heal San Francisco is also a wonderful resource.
Are you finding people coming to either your website or to you personally and accessing your help and your services and your counsel, and then they say, I never thought I would be in this position to ask for this kind of help, but, you know, people, because look, I'll be honest, there are people who think what you talked about and you know, psychologists, it's just kind of a bunch of, you know, tell me about your feelings, that sort of thing, right?
Yes.
All of a sudden it's become very real. Are you hearing from people who say, wow,
Yes.
for once, I get why it's so necessary?
Yes, and that's the part of humility. Humility is the new smart. It's being able to acknowledge the fullness of your humanity and say that I am a full human being with a full range of experiences and feelings.